Hi, I'm Lainey Ruby, one of the PGY1 community-based pharmacy residents with the University of Kansas School of Pharmacy and Ball's Food Stores. I'm discussing my research project titled Community Pharmacy Staff Knowledge and Accessibility of Mental Health Resources. To start off with, I want to provide some background information. In 2018, about 20% of adults in the United States had a mental illness, but less than half received treatment. Often, those with mental illness do not know where to seek help. In 2019, the American Pharmacists Association adopted policies addressing pharmacists' role as an accessible resource for mental health. The policies encourage employers to provide resources for pharmacy staff to assist individuals with mental health concerns. This study was created to provide pharmacy staff with mental health resources for use in referring anyone who may be experiencing mental illness to reliable professional and self-help resources. We sought to improve pharmacy staff knowledge of mental health resources and to determine the impact on pharmacy staff comfortability. We developed a 51-item pre- and post-intervention survey, which was administered to community pharmacy staff at the 19 Ball's Foods pharmacies. The intervention provided mental health resources to pharmacy staff for use in referring anyone experiencing mental illness to reliable help. We created a mental health resource document consisting of professional and self-help resources, including local mental health resources near the pharmacies. Additionally, pharmacy staff had access to a narrated PowerPoint presentation which further described the resources. Pharmacy staff employed by Ball's Foods were eligible for participation unless they completed mental health first aid training within the past 3 years. In addition to assessing pharmacy staff demographics, we also assessed pharmacy staff knowledge of mental health resources. We also assessed pharmacy staff comfortability and current pharmacy practices for providing mental health resources. Looking at the results in the middle section of the poster, the demographics chart is in the top left corner. The average pharmacy staff participant was a white female under the age 50. Majority were full-time employees, and there was an even number of pharmacy technicians and pharmacists who completed the surveys. In the top right corner, the chart compared the pre- and post-intervention surveys of employee-reported pharmacy practices. 30% of pharmacy staff reported experiencing a situation where mental health resources would have been beneficial. Before the intervention, less than 20% of employees reported having accessible mental health resources, and after the intervention, over 70% of employees identified having accessible mental health resources to provide for a person experiencing mental illness. The chart below compares pre- and post surveys of employee knowledge of appropriate mental health resources to recommend for a person experiencing a particular mental illness. There was a statistically significant improvement in knowledge of select crisis and helplines. Overall, 80% identified the mental illnesses which could be appropriately referred to a crisis helpline. The two graphs on the bottom compare pre- and post surveys of pharmacy staff comfortability providing mental health resources to a person at the pharmacy. The results show the median score of a 5-point Likert type scale, where 5 indicated strongly agree. Pre-survey responses are in yellow, and post-survey responses are in red. The graph on the left shows comfortability providing professional resources. There was a statistically significant improvement of pharmacy staff comfortability providing professional resources for any person with a psychotic disorder, substance use disorder, and suicidal ideation. The chart on the right shows comfortability providing self-help resources. There was a statistically significant improvement of pharmacy staff comfortability providing self-help resources for the 6 mental illnesses assessed. One limitation of this study is that the surveys were completed while working. Pharmacy staff may have been interrupted while completing the surveys and watching the PowerPoint presentation. Additionally, pharmacy staff may have completed the post-survey without utilizing the mental health resource document. We have drawn some conclusions from this research project. At Ball's Foods pharmacies, there was a need for readily accessible mental health resources, yet majority of pharmacy staff did not have mental health resources before the study. After implementing an employer-provided mental health resource document for pharmacy staff use and referring any person experiencing mental illness to reliable help, pharmacy staff comfortability providing mental health resources improved. Although pharmacy staff knowledge only improved for select crisis and helplines, majority of pharmacy staff were aware of having readily accessible mental health resources in their pharmacy to provide for someone experiencing mental illness. Further research should evaluate the long-term impact of employer-provided mental health resources for pharmacy staff use and referring any person experiencing mental illness to reliable help. Thank you so much for listening. Again, my name is Lainey Ruby.